It's a critical week ahead in LA County as health officials say they will soon know about a post-Labor Day surge.
Yeah, yesterday the county reported 31 new deaths and more than 1,200 new cases. And joining us live this morning is Dr. Erika Flores Uribe, an emergency physician at LA County's USC Medical Center. And we are so grateful to see you and grateful to have you here.
Good morning. Pleasure to be here with you all.
Hey, first question for you. What are you seeing in the ICU in terms of hospitalizations and severity of conditions of COVID patients?
You know, we've done a pretty good job in LA County in terms of making sure that we are taking the preventative measures to take care of ourselves and our families. At this point, we're waiting to see what the Labor Day surge would look like, as you mentioned. So it's early in this case. We're seeing about 776 hospitalizations a day on the 3-day average, which is lower than when we had that surge in July.
Doctor, how has the treatment and outcome for COVID-19 patients changed since the beginning of the pandemic?
Yeah, the treatment for COVID-19 has remained the supportive measures that we do to make sure that we're treating any problems with respirations, for example, providing ventilators as needed, as well as any other infectious measures that are needed for COVID-19. I think from this point, the really important thing to know is that there's, the messaging around a vaccine for COVID-19, and we don't have that at this moment, but we do have a vaccine for things like the flu. And influenza season is coming now. And that is something that can be treatable. And we know that we see a surge of influenza every year. And it's going to be really important for us to do what we can to make sure that we're protecting ourselves from 2 viral infections that, that can lead to death.
Who do you see as mostly being infected?
So we learned early on in terms of patients who are having comorbidities, the high-risk patients who are older, who have problems with respiration issues like asthma or COPD. So anyone with pulmonary issues could be at risk for getting both severe cases of COVID-19 and influenza. As we learned with COVID-19, we're seeing these cases higher in some racial ethnic minority groups, including the Latinx community and the Black community. And we're also seeing that this is not only affecting older populations, but also younger populations. So everyone can really be impacted and affected by both COVID-19 and influenza.
Doctor, can you tell us the best way to reduce transmission? We hear about face masks and hand washing and using gels to protect us and also not to get together. Is there anything that trumps all?
Yeah, so the really great thing in terms of what we're doing currently with the messaging around COVID-19 is that this both protects you from COVID-19 and the flu. So being able to stay home if we feel sick, keeping that 6 feet of physical distancing, washing our hands frequently, using alcohol-based gel sanitizers, and those face coverings will protect us both from influenza and COVID-19. Long 6 months, and many of us have quarantine fatigue with being at home, but being able to be persistent in what this would be, almost a marathon in terms of caring for ourselves and protecting ourselves is going to be critical as we go into the flu season, because we do see that the flu impacts our health system in terms of admissions and patients requiring critical care. So being able to protect ourselves from both is going to be critical.
All right, doctor, final question. You mentioned the flu. What advice do you have for those who haven't gotten their flu shot yet? Some people are afraid, and then I hear some people, of course, have said, old myth that, I wasn't sick until I got, the flu shot.
Yeah, so the flu is very safe. We've been providing the flu shot to many patients, including children and pregnant women. This is something that's highly encouraged and recommended by primary care providers and doctors. So the earliest that you can get your flu shot, which would be now, I would say call your primary care doctor so that you can get that scheduled done. The other thing is that the county has partnered with the county libraries, and there are opportunities to get the flu shot for free. And 211 remains a service for any resident of the County of Los Angeles. You can also call 211 to try to find a low-cost flu shot near you. So there's many places to get the flu shot. So my recommendation would be to get it as soon as you can.
Thank
All right,
you,
doctor. Yeah, thank you. And before you go, we just want to make you smile because our makeup artist is a fan of your hair.
Yes, that
this
pin-up
morning.
style.
She loves it. So thank you, and you're always welcome back.
Thank you so much. Stay safe.